First Nations. And today I'm joined by two outstanding leaders in healthcare. Our interim chief ambulance officer, Leanne Heppel, is with me in Vancouver. And our Northern Health Board Chair, Colleen Nice, is with me, I believe, in Terrace today. And it's great to have them on. You're going to hear Colleen Nice speak in a little bit remotely, and then you're going to hear from Leanne Heppel in a little while. I want to thank you all for joining us today. Today we're going to make two sets of announcements that have one continuing goal, and that's to improve healthcare services in the Northern Health Authority and in the interior and the north of British Columbia, and indeed on Vancouver Island, with respect to emergency health services. So we're going to make both. We're going to talk about both announcements today. The first is about the Northern Health Authority and addresses the challenges, the ongoing challenges of recruitment and retention of healthcare workers in the north. I want to acknowledge the work that's gone into this, particularly from the Northern Health Authority. It's part of a broader announcement we'll be making in the fall for a broader human resources plan for healthcare going into the future. But these are actions, interim actions that are taking place this year to help support and address issues in the north. I want to acknowledge the many people who have contributed to this at the Northern Health Authority, first of all, but also my MLA colleagues, Nathan Cullen and Jennifer Rice, who have contributed significantly to this in raising issues and pointing to concerns, and my colleagues, the Leader of the Opposition, Shirley Bond, and other colleagues in the north, such as Dan Davies from Fort St. John, who have also contributed to this, as well as mayors, such as Mayor Ackerman and others in the north who have contributed to this. They've raised these issues, we've talked about the importance of them, and today we're taking action that reflects our collective efforts to make things better for people in northern BC. Today we're announcing $6.38 million for programs to retain and recruit more healthcare workers in the Northern Health Authorities by making the north a desirable and accessible place for health professionals to live and work. To address this, actions are being taken at every level in Northern Health, starting immediately with the launch of a comprehensive healthcare worker rural retention program that is targeted towards priority communities and occupations. The program is designed to offer financial incentives and support for healthcare workers and will be funded directly by the Ministry of Health. It won't come out of the Northern Health budget at approximately $3 million. Further, funding of $821,000 from the Ministry will be put in place to continue the Travel Resource Program, TRP, and keep the more than 40 registered nurses and nice practical nurses who receive support from that program. We're also offering a flexible community fund of $115,000, again from the Ministry, that supports patient care delivery to support interdisciplinary teams and the Health Authority to work together and create a unique approach to address rural obstetrics needs and support 24/7 care for their communities, and help, in particular, stabilize care in the Northwest at Mills Memorial Hospital. The Ministry is providing $225,000 in funding to develop a child care program to support expanded net new child care spots and expanded hours of operation to meet the needs of healthcare workers often working, as we know, 12-hour shifts. Anticipated regions for this include Kitimat, Hazelton, Prince Rupert, Chetwynd, Dawson Creek, and Fort St. John. The Ministry is providing $750,000 to develop a housing program in communities where suitable market housing is a barrier to permanent staffing and short-term deployments. Regions include the Robson Valley, Kitimat, Hazelton, Prince Rupert, Chetwynd, Dawson Creek, and Fort St. John. We're launching the Rural Urgent Doctor and Aide 24/7 virtual support pathway for physicians and other healthcare professionals in rural communities with $825,000 in funding. And funding of up to $645,000 by the Ministry is also geared towards creating clinical management supports for Prince Rupert and the Northeast that increases clinical program management capacity to support new graduates, provide more resources for management competency development, increase number and distribution of managers, and improve management support systems. These measures come together, I think, at an important time in healthcare across the Northern Health Authority. We have, as you know, at the moment, very significant challenges. Really, at this moment, for example, with COVID-19, We have the highest level of COVID-19 per share of the population in Northern Health of any region in BC. And there are challenges nonetheless, challenges that are structural and fundamental, and ones that we have to continue and get at and address now. I want to thank my colleagues in the legislature for being part of this. I want to thank everyone at the Northern Health Authority and their team. And in a little while, you'll hear from the chair of the board of Northern Health, Colleen Nice, who will speak more about these issues. The second set of issues I want to talk about today is BC Emergency Health Services. And I want to express, first of all, my appreciation to our interim Chief Ambulance Officer, Leanne Heppel, who's here with me today, a really extraordinary board chair, Jim Chu, for all of the efforts they have made since we laid out our action plan in July to address issues at BCEHS. They have worked very closely with QP Local 873, but also met ambulance paramedics and people in different parts of the province. It has been great to have Leanne and Jim playing this role, and Jim and Leanne are both exceptional leaders, so we're very proud of their efforts. People will know that in June, but really throughout the period, there was all of the issues around June 28th and the days subsequent to that, but also really in this part of the pandemic, starting in June, when we saw a very significant rise in ambulance calls across our system in BC. Those calls tested our province's emergency resources. In BC, our goal has been to have and is to have the best ambulance system in the world, delivering the best possible service. That's why since 2017 we've increased the BC Emergency Health Services annual budget from $424.25 million to $559.12 million. We have doubled the average annual spending increases compared to previous years. This has meant more paramedics, more dispatchers, and more ambulance on the road. And all of that is critically important. It is, in fact, the most significant single area of increase in healthcare other than mental health and addictions we've had since 2017. Between 2017 and 2019, we added 115 paramedic positions to support direct patient care, improve service and response time, and modernize dispatch operations. In the first half of 2021, 271 new permanent paramedic positions were added and hired into BC Emergency Health Services. Nevertheless, the heat wave showed us that there was more work to be done. And since then, our government has made progress on a number of measures that I announced in mid-July to restore and strengthen emergency health services. One of the key aspects of that, and while there's a lot of focus and is a lot of focus of our efforts and Heppel's efforts and Jim Chu's efforts on Metro Vancouver and on urban areas, Metro Kelowna, urban areas in general, one of the key areas, one of the most important areas for communities is ensuring ambulance service throughout this enormous province and providing that service. So I'm pleased to announce today, consistent with what we talked about before, but expanded beyond this, that 24 ambulance stations in rural and remote communities will be converted from on-call paramedic staffing to 24/7 Alpha stations. This is 2 more stations than what we looked at when we first talked about this in July. Communities benefiting from the enhanced ambulance service are Lake Cowichan, Port McNeill, Tofino, Cumberland, Bowser, Pemberton, Ashcroft, Barrier, Caramios, Lillooet, Princeton, Sicamous, Clearwater, Revelstoke, Peachland, Fernie, Golden, Kimberley, Burns Lake, Fort St. James, Houston, Vanderhoof, Chetwynd, and Fort Nelson. This means we'll have an enhanced ambulance system and a more stable paramedic workforce in rural and remote communities that can more quickly respond to emergencies. What this also means is better paying, predictable, full-time jobs for our paramedics, which will in effect improve, and in fact, improve our retention and retainment of the workforce. As well, 26 smaller stations that have moved to or will move to schedule on-call staffing model are getting more permanent regular paramedic jobs starting on November 1st. Communities that will see this enhanced service are Alert Bay, Atlin, Bear Lake, Blue River, Cortez Island, Dease Lake, Edgewood, Elkford, Field, Goldbridge, Grand Isle, Greenwood, Hudson's Hope, New Denver, Port Alice, Port Clements, Riondell, Seward, Seton, Seton Portage, Swantula, Southside, Stewart, Tassus, Texada Island, Wells, and Sabalos. Hiring is also underway for the new 85 new full-time paramedics and 30 new full-time dispatch staff announced in July. They will be in place in October and November. Under the guidance of our new interim chief ambulance officer and our new board chair, BCEHS has been working hard to roll out important changes to its staffing model across the province to improve services to patients and stabilize paramedic staffing, especially in rural and remote communities. When you need an ambulance, that service is the most important government service provided. And our commitment is not just to Vancouver, although it is to Vancouver, not just to Surrey, though it is to Surrey, not just to Abbotsford, though it is to Abbotsford and Kelowna and Kamloops and other urban communities, but to everyone in the province. And these announcements today and this effort reflects that. I want to say that further to this, that our new interim chief ambulance officer has been working with paramedics and dispatch leaders to ensure BCEHS is fully prepared for the continuing higher demand we are seeing across the ambulance system. This includes being more flexible in staffing and resource adjustments as needed, increasing clinical support in BCEHS dispatch centers to help triage and manage calls, 24/7 manager support in dispatch to help with delays and escalation, introducing new low acuity patient transport units for Metro Vancouver and the Fraser Valley to transport less urgent patients and ensure ambulances are available for high acuity patient response, and working with health authorities, especially in busier hospitals, to reduce ambulance turnaround times to help get paramedics back on the road. I am so appreciative to the work that Leanne and Jim have done over this summer and now as we approach the fall. You may recall in my introduction of Leanne, and I'm going to introduce her third in the order, that she's a trained clinical nurse specialist. That prior to becoming the interim chief ambulance officer, she was our Providence Healthcare's chief operating officer, acute care, and chief of professional practice and nursing. She has some serious healthcare game. I think that's the summary. And it's great to have her, and I want to thank her and Jim for all their work. So significant improvements to address recruitment and retention issues in Northern Health. Significant plan announced and being implemented to improve ambulance service in every part of BC. This reflects what communities have asked of us. It reflects the effort that's been made to bring the BC Ambulance Service, BCEHS, into the 21st century. And that work has been going on for some time, and I'm very proud of that work now. And so with that, to deal with both of these questions and provide some more information, I'm happy now to introduce Colleen Nice, our outstanding board chair in Northern Health, who I think is talking to us today from Terrace, but she might be in Prince George. Over to you, Colleen.
Thank you very much, Minister. Yes, I am calling in from Terrace this afternoon. So good afternoon and hello, everyone. I'm honored to be with you today representing the Northern Health Board of Directors, as well as Northern Health staff and physicians. I would like to begin by acknowledging with respect and gratitude the Tsimshian Nation, especially the Kittiwah people, whose traditional territory I am speaking to you from today. Recruitment and retention of healthcare professionals is a challenge nationally and globally, and we know that our challenge is similar to the experiences in other northern jurisdictions in Canada. Indeed, it has been a long-standing issue for Northern Health. And as an organization, we have worked closely with the province to attract and retain a workforce that can meet the needs of our communities. And even with that, despite our efforts, we continue to face hurdles, and some of our communities have greater challenges than others. This investment, announced today by the Minister, for which I say a huge thank you, will contribute significantly to addressing the recruitment and retention challenges that Northern BC jurisdictions are experiencing. Healthcare employees are the foundation for providing quality care, and it's important that we invest not only in recruiting staff, but also in ensuring that staff and physicians have the supports they need. And this announcement provides an investment for Northern Health to implement initiatives that we believe will make a difference. We believe it will make it easier for new and current staff and their families to relocate or stay in northern communities. And while we implement these new initiatives, we will continue to aggressively recruit professionals. And we will also continue to recognize that our communities have a role in attracting professionals, as this is just not about attracting people to a hospital. We are attracting professionals to a community and to a lifestyle. So we will continue to work with communities as we have, and look forward to partnering on new ideas and plans to implement these initiatives over the coming weeks. So thank you again, Minister Dix, for recognizing the importance of this type of investment and for making it happen. Thank you.
Thank you very much, Colleen. Now it's my honor to introduce here in person in Vancouver, Leanne Heppel, to say a few words. Leanne, our Chief Ambulance Officer.
Thank you very much, Minister Dix. It's my pleasure to be here. And hello, everyone. I'm Leanne Heppel. I started my role as Interim Chief Ambulance Officer about 2 months ago. I've been working with the BC Emergency Health Services team to put into action the steps the Minister outlined in July to improve our ambulance services. We know that citizens expect that when they call 911 with an urgent need, paramedics will arrive quickly, and we are working to ensure that happens. We are on track with filling the new paramedic and dispatch positions, and I know this is going to create more stability in our staffing for urban, rural, and remote communities. We are also working hard to make BCEHS truly a great employer, where staff are healthy and supported in their work, caring for patients. And so we are moving quickly to identify what will best augment our current mental health supports. I have been spending these last 2 months doing something that I consider extremely critical, and that is getting to know people on the front lines, the paramedics, call takers, dispatchers, patient transfer coordinators, and all of our staff and leaders. I have spent time with the paramedics on the street and in the Vancouver dispatch centers, and I look forward to getting out to other stations across the province. I've spoken in person and virtually to hundreds of staff, community leaders, and health authority partners. I really appreciate hearing ideas for the future and ideas to address the challenges we are facing. I continue to be impressed with the staff's hard work, commitment, and pride. Despite the overall fatigue from rising call volumes, natural disasters, the ongoing opiate crisis, and the persistence of the pandemic, the team's commitment is strong to the citizens of British Columbia to ensure help is available quickly when people need emergency care. I have also heard many positive comments about the rapid changes we are making. Our staff are grateful for the additional permanent positions to help address the increased call volumes and patient needs, and for the changes we're making to ensure non-emergency calls are being met in different ways. I'm hearing excitement from many paramedics to finally have the opportunity to work in permanent positions in the communities they live in. We are working closely with our employees, the government, and the unions to develop plans to ensure our ambulance service continues to be there for British Columbians when and where they need us. Thank you, Minister Dix. I look forward to working with you and your ministry, our new board chair, Jim Chu, our unions, and most of all of our frontline staff, to make sure we have a great ambulance service for the people of British Columbia. Thank you.
Thank you, and I want to express my appreciation to the ambulance paramedics, both on the ground as frontline workers, our dispatchers who do extraordinary things, our management, our team of managers, the union, the ambulance paramedics of BC, QP Local 873, and Troy Clifford, his whole team. This is a continuing effort that we're all making to invest in our ambulance service, to ensure that people get the ambulance service they need and they deserve, not just in Metro Vancouver, but everywhere in BC. And with that, I'm happy to take your questions.
As a reminder to media on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Penny Daphlis, CTV. Please go ahead.
Hi there. Thanks very much for taking my question. Minister, yesterday you tweeted about a newborn and a tween in ICU with COVID. So I'd like to know what you can tell us about their condition, where they're being treated, and why would you reveal such serious news of an elementary-aged child and a newborn with COVID on Twitter without any details or context for parents?
So first of all, what we're providing is information that's been requested, age information about who's in the ICU and who isn't. And happy to report that the infant in ICU has been discharged healthy, and that's good news. We don't talk about the cases in general, but we've provided information about all the different age categories, and I think it's part of what we're going to continue to do to tell people what the situation is with the seriousness of COVID-19. And what we see in a general sense is under 50 people, almost all of our cases, if not all of our cases, are unvaccinated. None of our cases under 50 yesterday were fully vaccinated. So the reason we provided that information, which we've done for a few days, is to give people detailed information about about who's sick and what their vaccination status is in our ICUs. And the information won't change very much today. There will be that update. You won't see the one case there, but you'll see that approximately 140 people are in ICU today dealing with COVID-19, and that the vast majority of them, I believe 121, will be unvaccinated. And I think that's useful information for people to know that, in fact, the small group of people in BC, and it's now down to 14% of British Columbians who are unvaccinated, represents a large share of the population. So that's the information, and we're providing that information as we do in some of our detailed updates, and we'll continue to provide that information. And obviously, with respect to the one case, it's good news. We're providing people, I think, with the best critical care in the world, and you see that in our results, that people are recovering, but that recovering when you have COVID-19 is hard.
Penny, did you have a follow-up?
I do, yeah. I guess I still want to know about the elementary-age child that is still 10 to 12 years old that is presumably then still in the ICU. And what can you tell us about children that are hospitalized? Even if the ICU stay was fairly brief for the newborn, are they still in hospital? What is the average stay for children in hospital? This is the kind of information that parents are really concerned about when they see what's happening in other jurisdictions. Well,
as you know, when we provide this information, some people asked about children in ICU, and there weren't any children in ICU. And right now, I think there's one in ICU receiving critical care, and what we do have is a fairly low barrier for critical care. So we want to make sure people are well and get the best possible care. We don't talk about the individual cases, as you well know, Penny. But what I can say is, and what those numbers show, our ICU numbers show by age group, is pretty straightforward. That people who are unvaccinated right now are at risk of some serious health effects from COVID-19, and 121 people, when you consider that we have around 520 baseline critical care beds across the province, and then we've added, of course, surge beds, about 230, and we have about 430 people in those beds right now. You see what a large percentage of the people in ICU in BC are dealing with are unvaccinated people dealing with COVID-19. That their risk is high, the impact on unvaccinated people of the Delta variant can be significant, and that's why we want to encourage everyone to get vaccinated. So we're going to provide, and we're continuing to provide, detailed information on cases, and you'll see that, for example, in the weekly reports that are put out by the BC CDC and the daily reports that we're putting out as well, to show and lay out to people the impact of vaccination. But I think what people need to know is that what we all should do is get vaccinated. And overall, and you've seen, because you review these every week, you've seen the hospitalization numbers. Overall, we've had a very low rate of hospitalization amongst children and youth since the beginning of the pandemic, and that continues to be the case now.
Our next question is from Richard Zussman, Global News. Please go ahead.
Minister, the BC Nurses Union says the decision yesterday to require all healthcare staff to be immunized could lead to a crash in the healthcare system with those not immunized losing their jobs. What are you going to do to prevent a crash in the healthcare system? And can you assure people that if there are a lot of people removed to the system due to the fact they won't be immunized, you're going to find some way to replace those positions?
I think what we're doing is what we've been doing really since the beginning of the pandemic. Healthcare workers were in first priority to get immunized. A very high percentage of healthcare workers have been immunized, and we want everyone to get immunized. And there's going to be, and that was announced not yesterday, but some weeks ago in long-term care and in assisted living. In long-term care and assisted living, you're talking about roughly 49,000 people. And we have, we're going to work through to October 12th to ensure that the maximum number of people are immunized. Equally, in acute care, for example, circumstances where people frequently, as you know, there are many people in acute care who resemble the health status of those in long-term care, who are in alternative level of care beds in acute care, who are effectively in long-term care while being in a hospital. The same risks and circumstances apply. We're in a pandemic. It has very high risks in the healthcare setting. And we have these very effective, very safe vaccines. And so there's an expectation that everyone who works in the healthcare system is vaccinated, because the level of risk in the healthcare system justifies that. Hundreds of people died in long-term care. And so in other venues and other settings, that hasn't been the case. But in long-term care and assisted living, and indeed in acute care, we've seen significant outbreaks of COVID-19. And that's why it's very important in this time, given the risks of COVID-19 and the risks of the Delta variant and the statistics that we've just talked about, that we're asking all healthcare workers to be vaccinated. That is not without challenges, and we do not do not take that decision lightly, because, as you say, there may be people who choose not to be vaccinated and won't be able to be available for work. But that said, I don't think we can have a situation, given the seriousness of COVID-19 and its impact, where people are working without vaccination. That was the conclusion. That's the direction from public health. It's the right direction, and we're going to work very hard with the BCNU and the Hospital Employees Union, the Health Sciences Association, the doctors of BC, with midwives, with ambulance paramedics, with everyone else, to ensure that everyone gets vaccinated.
Richard, did you have a follow-up?
I get all that, but we don't know how many, not to pick on the nurses, but they're part of the healthcare system. We don't know how many will get immunized. Based on what Dr. Henry said yesterday, the belief now is it's around 80%, which means there's about 8,000 nurses who are not immunized. Hypothetically, we could have up to 8,000 nurses no longer on the job post-October 26th. I think we all assume that number will go down. But even so, you haven't addressed the issue of what will happen if we're 2,000 nurses short, 4,000 nurses short, or short in other parts of the system, including paramedics. These are people who are already under immense pressure. What is the province going to do to address those potential shortages due to the vaccination policy?
Well, I think it's important not to speculate too much about the numbers. We know that the massive majority of healthcare workers have been immunized everywhere in BC. We know that the average, not of healthcare workers, but of everyone else over 12 is now 86%. The average of everyone over 18, which includes this category, is about 87% of people in BC. That's the average have been immunized. So I wouldn't use 80% as a baseline, Richard. That's what I think the point I'm making. And if 87% of all people in BC have been immunized, the number for healthcare workers will be significantly above that. That said, we don't want to lose anybody. So we're going to be working with people to ensure that the maximum number of people are immunized. And we do have to prepare, and we are preparing to deal with the situation after October 12th. But the reality of it is this, that, and healthcare workers know about the importance of immunization. It's central necessity in these times. You see it in these numbers. They're living it every day. Nurses talk to me who work in ICU regularly, email me this, talk to them about the situation of nurses in ICU dealing with unvaccinated people. We don't have to tell healthcare workers anything about COVID-19, and I'm very encouraged that the rate of uptake is going to be very, very high. But you're right, we're going to have to prepare for circumstances should people leave certain positions, and it's why, in part, we've continued to add healthcare workers in this pandemic. Today we're adding ambulance paramedics positions. We did so earlier this year. We've done so multiple times over the last number of years. We've added, since we announced our healthcare worker program in long-term care, 5,000 workers. And we're going to have to continue to do that work. And it's regardless of the issue of vaccination, by the way. We continue to have to build out and hire more healthcare workers in every part of the province, whether it's Interior Health or Northern Health. And we're just going to continue to do that.
Our next question is from Matt Preproth, Alaska Highway News. Please go ahead.
Hello, good afternoon, Minister. Thanks for the announcement today. Curiously absent was any new funding for perhaps the nursing program that's just launching up in Fort St. John. Was that a consideration at all? And if not, why not?
Well, I'm delighted you mentioned it, because that's the first nursing program ever in Fort St. John. We've launched it recently. It's happening. We've got new places in place, and that's exciting. But it takes some time, as you would expect, to train nurses. So these are immediate steps in this fiscal year to help address the issue now. And one of the key issues that we're addressing, I think, that affects everybody, I mean, we've added those programs. We've added health sciences professional programs in the past. We're going to continue to do that, to strengthen our training in the Northern Health, because I believe when people are trained in the North, from the North, trained in the North, will stay in the North. And so we're going to continue to do that. I absolutely agree with that. But we're talking about the immediate here, and ensuring, for example, that healthcare workers, and it's one of our challenges in the North, when they start, continue to be there, that other pressures put people away, so we don't have people who we hire and we put in place and don't have the supports they need to stay in place, because we want people to have decades-long careers in the North and not leave after 2 or 3 years and then have to be replaced. So that announcement was a fantastic announcement. It was made by my colleague Melanie Mark when she was Minister of Advanced Education, is now my colleague Ann Kang. That's a great announcement, and there's more to do. We're getting started, and it's great news, and the cohort is going to be great, and they are going to be leaders, that first cohort that goes through the program in Fort St. John. I want to do more of that, but doing that doesn't preclude needing to do other things. And retention, it's not just about recruitment, it's about retention and ensuring that the healthcare workers that we successfully recruit in Northern Health stay in Northern Health. And this reflects the contribution, as I say, of lots of members of the legislature, our Northern Health teams, of community leaders, and of the unions who have met with me.
And did you have a follow-up?
Yes, thank you. I'm curious to know, Minister, what the province is doing to work with the federal government right now. I see Health Canada lists about 4 vaccines and about half a dozen other medicines currently under review for COVID-19. Do you have an update on what the province and the federal governments are doing to get these drugs approved and perhaps added to the pandemic toolbox?
Well, right now we have a pretty good toolbox that has freely available and some of the most effective vaccines in history. Available in BC, Pfizer, the Pfizer vaccine, of course, the Moderna vaccine, AstraZeneca, which has played an important role in the vaccine rollout to date. British Columbia, I think we were a province that also wanted this federal government to provide us with Johnson & Johnson, but that ultimately didn't happen. So we're enthusiastic about anything that can make a difference and supportive of that. You'll know that my Deputy Minister, Steve Brown, my Associate Deputy Minister, Peter Pokorny, Dr. Henry, yourself, Dr. Gustafson, are involved in all of these national discussions to build national efforts. So we work pretty closely with the federal government all the time. And our discussion has changed, thankfully, because in March and April and May and June, it was we need more vaccine, and now we have vaccine for all those who will want it, and we're encouraging people to take it. And with that in mind, I want to encourage everybody in the north to get vaccinated, and there are particularly this week across BC, there are programs to increase vaccination rates amongst school-age children, 12 to 17, and young people. And you see it in these numbers, and I can't tell you how enthusiastic I am about how people 18 to 24 are leading this campaign, this vaccine effort. Today they represent, again, first place in registrations, first place in new appointments, first place in vaccines delivered, and now today 87.3% of those 18 to 24 are vaccinated. That is above the provincial average of 86, and it continues to climb, and I'm expecting it to reach 90.
Our next question is from Amanda Hosgood, the Tyee. Please go ahead.
Hi, Mr. Dix. I'm calling from Smithers, which is seeing by far our highest COVID numbers since the pandemic started. I'm just wondering if you could comment on how medical services are holding up across the north given the high COVID numbers.
I would say, I mean, these numbers are very challenging. I mean, we've seen days where there are more than 100 cases. We have a relatively high level of test positivity. We're engaging, and we still have more work to go on immunization in the north than anywhere else, and significant work with respect to contact tracing and supporting people who do get sick. And we have, given our capacity in the north, a significant number of people in acute care and critical care. So this is a challenge, and we're providing both through the BC Centre for Disease Control and other means, other supports to Northern Health, because this is a time where in Northern Health and in Interior Health in particular, we've seen the most pressure from COVID-19 of any health authority at the moment, at the present time. We know at different points during the pandemic it was much more, the higher levels were seen in Metro Vancouver, but right now that's in the north. So we're asking our health teams in the north to do a lot. We're currently at 74% first dose immunization across the north, but there are significant variations as between communities. We're seeing obviously the significant number of cases and test positivity in the Northern Health region, and so we're continuing to work on both those things.
And did you have a follow-up?
Yeah, I'm just curious to know if Northern Health Authority could be seeing tighter restrictions if this continues.
Well, as you know, Dr. Henry announced some of that last week, so we've put those restrictions in place in support of immunization efforts. And of course, yesterday, the BC vaccine card came into place, a vaccine card which will allow people to gather safely with other vaccinated people in key optional services, but important services across the north and across BC. So yesterday, coming into place, the BC vaccine card. Last week, some specific measures with respect to gatherings, because it's in such gatherings that we see levels of transmission. And of course, you know that there's a mask mandate everywhere in BC in indoor public spaces. So all of these things, the actions taken specifically for the north last week, which mirror the actions that have been taken in Interior Health, the BC vaccine card, the exceptional work that's being done by our immunizers across the north who are continuing to work and go back and work again, all of the work in contact tracing in the north. These are significant measures, and of course we're going to continue to support northern communities. Today is an example of that, although today is a vision that's beyond the immediate in terms of COVID-19 and supporting healthcare workers in the north.
Our next question is from Shannon Waters, BC Today. Please go ahead.
Sarah, I have a few questions about your announcement from 2 months ago regarding additional resources for the ambulance service. When you made the announcement, it was framed as taking immediate action to reinforce ambulance operations. Now we're learning that it's going to take 3 to 4 months before these resources are deployed. I'm also curious whether you're able to say how much money is being dedicated to these resources. and whether any of the positions, whether the paramedics, the dispatchers, or the new ambulances have actually been hired or activated at this point in time, and if so, how much funding has been dedicated to that?
Well, as I noted, first of all, the annual budget for the BC Emergency Health Services increased from $424.25 million to $559.12 million. That we added between 2017 and 2019 115 positions. In the first half of this year, 271 new permanent paramedic positions were hired. And of course, these positions are in the process of being hired now. And they're real people. I think it's fair to say, and consistently across the board, shortened the hiring process. This is about recruiting and making a permanent change that reflects changes. So when we were announcing that in July, we were in the process of hiring a lot of people, and now that process is arriving in success. You're seeing the impact, the immediate impact in rural and remote communities of the changes we've talked about today. And the hirings that's going to support stations around, especially around Metro Vancouver, but other urban areas in the province. So I think it's going, it's been going well, and is right on track of what we need to see happen. I also think that we have put consistently resources in place, and we identified those this summer to deal with, for example, weekends where we saw significant high heat, nothing like what's sometimes called a heat dome, but high heat throughout the summer, and we announced what those specific changes were put in place, and that was under the direction of our Chief Ambulance Officer. And I think all of these changes reflect our strong commitment to the ambulance service, and they're net increases. And hiring 271 people this year already, in addition to the ambulance paramedics and dispatchers, is important work. And they're real people. We don't conjure them. And this is a short period of time, and we're getting on with it. We're just doing the work.
Shannon, did you have a follow-up?
I don't think I heard an answer to most of what I asked, so I'll reiterate. How much money is being spent on the 85 new full-time paramedics that were announced on July 14th, the 30 full-time dispatchers, and the 22 new ambulances? Have any of those positions been filled at this point in time? And if so, how much funding has been dedicated to filling those positions?
As I just said, they are being filled. The ambulances are being ordered. The dispatchers' positions are being filled, and we're in the process of filling them. And they're all funded, and they're all in place, and they're all coming. And this is the work that we do. And I think when such an announcement was made, obviously, you don't hire everybody instantly. We're in the process of hiring a lot of full-time paramedics. We're transitioning people to full-time status at that time. The work's being done, and I think it's been done with real dispatch, if I may say, to use that term. And the people are being hired, dispatchers are being hired, the positions are being transitioned in rural and remote BC, and the ambulances have been ordered. So there's not much more you can say than that.
Our next question is from Lisa Eusta, News 1130. Please go ahead.
Hi, Minister. I just wanted to follow up on what Richard was asking, because you said, yes, you need to do some steps and that you're bolstering and you're working with the BCNU. But people who are really concerned want to hear something sort of more tangible, whether it's just weeks away, that this mandate comes in, and, looking at Dr. Henry saying up to 5% are people who, of the general population, are people who are not ever going to get vaccinated, and that, as Richard said, could be thousands. So what's going to happen if thousands decide that they will choose not vaccinating over having a job?
Well, I think what people expect is that everyone to be vaccinated in our healthcare system, and that reflects the needs of the COVID-19 pandemic. And our leaders in providing scientific advice, Dr. Henry, Dr. Gustafson, and others have recommended it, and we're proceeding with it. I think the idea that you wouldn't proceed with such an idea because it's too hard to do is not the right idea. It's not our approach to COVID-19 at all. We need everyone in healthcare to get vaccinated, and people in healthcare, I think, overwhelmingly understand that. And so obviously we're preparing for that, but our key goal right now is to ensure that we absolutely have a maximum amount of people vaccinated. And the reason for that isn't just to deal with what will happen on October 12th in long-term care and assisted living, what will happen on October 26th in the community and acute care. It's to ensure that everyone gets vaccinated, because that's how we keep people safe. So, you know, when you talk about people's concerns, I think people would expect that workers in healthcare are vaccinated against COVID-19, given what we've lived through together in the last 18 months. And we're working hard to see that that happens, to make sure that that happens, to make sure if people have questions that they're answered, and to work with them to address the situation. So I'm not going to speculate. We're obviously preparing for that day. But the main preparation we have to do is what everyone expects, is that everyone in long-term care and assisted living gets vaccinated, who's directly involved in patient care, I should say, and that people in the healthcare system are involved in direct work with patients or clients, depending on the circumstances, get vaccinated. And that's what we're doing. And you're quite right. It's not easy. But like everything else, we're making preparations in advance and working hard to ensure that we're ready for those days. And this is, you know, we got questions yesterday, and we have questions about third doses. We don't know with respect to the need for third doses, but what we do know is that we need to be prepared and have our system in place, so if that decision is made at some point in the future, we'll be ready to go. We don't know when children 6 to 11 may have access to a vaccine against COVID-19, but we need to be ready, and we have an outstanding team led by Penny Ballon getting us ready. And so those are the things we're doing, and of course we're preparing for this, but the main goal right now is the public goal that I think just about everybody agrees with, that everybody in our healthcare system needs to be vaccinated, and we're working hard to see that that happens.
Lisa, did you have a follow-up?
Yes, and I'm not at all assuming that you shouldn't do it. I'm asking what's going to happen if the worst happens. You know, we heard about Langley ER that they were down to 50% of their staff at one point this week, and were having to divert ambulances and divert people. And if that's happening before any staff are leaving because of the mandate, I'm just, like you're saying, that you're making preparations. Is there anything tangible you could tell me that is being done for the worst case scenario of how our hospitals will be staffed if the worst case happens?
Oh, Lisa, what's disruptive? And I just, every Thursday we publish the numbers in long-term care and assisted living of outbreaks. And you're very familiar with that. You look at it every week, I know, and you'll see the number of staff people in the course of the pandemic, especially pre-immunization, who got sick with COVID-19, all of which had a profound effect on the delivery of care. It's not just the risk that some people who are not vaccinated may leave. It's the risk to health human resources of COVID-19. And we've seen this for months and months and months and months. And so the reason why we're taking this step is to support and protect the healthcare system and all of those in it, including those working in the healthcare system. That's why we've taken the steps. And we're obviously, these decisions were not taken lightly. They're difficult decisions to take because the impact on individuals can be significant, but so can COVID-19, so can its impact on particular facilities. And I think we have to continue, and I hope we will continue together to do everything we can to stop the transmission of COVID-19 in facilities. But you've seen it, and I don't need to list off the facilities and the cases. In the case of Vancouver Coastal Health, hundreds of staff went into facilities to support them, and those were real staffing challenges. I know from personal family experience what it can mean when COVID-19 comes to a facility. So these are necessary steps, and the impact on health human resources is not just the potential risk, but the benefit of ensuring that those facilities are safer.
We have time for one more question. Our last question today is from Isabel Ruggins, CTC. Please go ahead.
Hi there. My question is regarding today's announcements made. What is the link between that and the heat dome, and how will that respond to some of the concerns we saw this summer in regards to ambulance delays and long wait times?
Well, I think what we've seen over the last 3 years is a significant increase in ambulance paramedic workforce. What we've seen, not just in the heat dome, but prior to where we saw, I think on particular days, almost 2,000 call-outs for ambulances, which is dramatically above, and many more calls than that. We saw a higher ceiling of public demand for ambulance services. So prior to the pandemic, the average number of calls on a given day at the BC Ambulance Service call outs was 1,540, and we went day into day into day when we were significantly above that across the ambulance system. It's a little bit above it now. I think yesterday it was in the low 1,600 range, so it hasn't been as high the last number of days. But we need to meet that challenge and that demand in general. You're never going to necessarily meet the demand that's twice as much, it's 3 times as much as what you normally expect in a given day. But we need to address some of that demand. So what are we doing? We're adding ambulances, we're hiring more paramedics, we're hiring more dispatchers, we're giving greater support to management, we're increasing ambulance services in the interior. And a lot of these changes don't have anything to do specifically with the heat wave of the summer, especially the ones that I talked about today. They have to do with building an ambulance services there for people across a vast terrain where there are fewer people, and increasing services in all of those places. And I think doing that makes a lot of sense for people. And they're challenging questions, because often you'll see communities with relatively few calls, but the calls they get are extraordinarily important. And how you manage that system, we do it in a number of different ways, including the development of community paramedicine around the province, which is something that came from a previous time when Mr. Abbott was health minister, and other measures we take to improve the ambulance system everywhere. So I think on balance, these are strong initiatives that respond, yes, to the events of the summer, but also respond to the needs of an ambulance system in the 21st century. And the idea that you can have a primarily on-call ambulance system in vast parts of the province in dealing with today's distribution of economic activity in the province, the idea that you can do that, we need to establish and solidify our ambulance service everywhere. And we needed to do that in June, and we needed to do that before June, and we need to do it now, and that's why we're acting.
Isabel, did you have a follow-up?
I do. Following up on Lisa's question, you said regarding potential staffing issues if nurses or healthcare workers decide to walk away from the job. You said preparations are being made. You don't want to speculate, but preparations are being made in case. What do those preparations look like? And if we can get an answer in French, please.
Well, just to say, I think what I said in the response to Lisa's question is that COVID-19 itself has had a significant impact on health human resources everywhere in BC. When there are outbreaks, it happens in every single case. There's an impact on health human resources. So reducing outbreaks and ensuring everyone in the system is working has a positive effect on health human resources in that sense. But of course, you make a decision like that. That's why we're going through it systematically. We're reviewing every facility around BC, what the level of vaccination is, what effort we have to make to raise that vaccination level if it's too low. But you know, I think that like a lot of things in this pandemic, what we're talking about is difficult but necessary. Necessary for health human resources, necessary to protect patients, necessary to protect staff. And as a result of that, we're preparing for the circumstances that might exist if some people, of course, choose not to get vaccinated and choose not to effectively not to continue to work in their jobs. That's a challenge. But so is the challenge of COVID-19 when there are outbreaks in communities and people are off for significant periods of time. And so we have to balance that out, and we have to be ready. And it's not going to be easy, but we'll be ready.
And that's all the time we have for today. Thank you, everyone, for joining.
Thank you.